thank you all for coming along, and a big thank you to Gadigal Elder, Uncle Alan Madden, who's had to leave, but thank you for that welcome to country for us this morning. I'm David Spears. It is wonderful to be here on the lands of the Gadigal people, of the Eora Nation, and I'd like to pay my respects to elders past and present. Great to see so many of you here for the launch of this important report. I can see most of you have grabbed a copy. This really is something quite unique. I can say in my 25 years or so of covering various parliamentary reports and royal commissions and government inquiries and so on, I don't recall anything quite like this. It is a completely independent review. It is funded by philanthropists and conducted with a broad remit, really, to look into something that impacted all of our lives and impacted our lives enormously over the last few years. So this wasn't politicians conducting an inquiry, asking questions themselves and producing a report themselves at the end, nor was it an inquiry where witnesses were compelled to give evidence. Hundreds, though, did want to take part in this. They did so of their own volition, and they were allowed to do so confidentiality, to speak freely about their experiences at the front line and in the back rooms during COVID. Now, that included government representatives, it included the public servants who were advising them, it included academics, business leaders, community leaders, unions, those, as I say, on the front line in hospitals, mental health facilities. They took part because they wanted to help answer the big question at the heart of this review. What can Australia learn from this pandemic, and how can we be better prepared for the next health crisis that comes along? Now, the government has promised a Royal Commission at an appropriate time. When that might be, when we might then eventually get a report, is really anyone's guess. And look, yes, this pandemic isn't over. We have entered, I guess, a new phase. Lessons are still being learned and will still be learned, but that doesn't mean we shouldn't take stock now of what Australia got right, what Australia got wrong, and what lessons we can take from all of this so that mistakes aren't repeated. The report is titled Fault Lines. And look, it really is an appropriate title for what's identified as perhaps the most important overarching lesson of COVID, to have social fault lines front of mind. Let me read you just one line from the report. Like hand sanitizer in a paper cut, COVID-19 exposed the cracks in our health, social, economic, government and political systems. This virus exacerbated pre-existing vulnerabilities. And I think that's very true. The panel that led this review includes some very well-known, highly respected and importantly apolitical Australians. Peter Shergold, Gillian Broadbent, Isabel Marshall and Peter Varghese. And we're going to hear from all of them in a moment. I'll give them proper introductions then, but I'd like to, once we begin our conversation about their findings, but I want to start with an introduction for Peter Shergold, who's chaired this process. He was a senior leader in the Australian Public Service for 2 decades, holding many roles, including as Australia's most senior public servant, the Secretary of the Department of Prime Minister and Cabinet. Since leaving the public sector in 2008, Peter has been the Chancellor of the University of Western Sydney, for many years now. He's also been the Coordinator General for Refugee Resettlement in New South Wales and Chair of the Rural Leadership Foundation, amongst other roles. Please welcome Peter Shergold.
Thank you very much indeed, David. Thank you to Alan Madden. We are sitting on Eora land. Eora, as best I can tell, simply means of this place. So for all of us who have come to this place, I do pay my respects to the people who were of this place for tens of thousands of years. You know, the spread of a novel coronavirus from China at the beginning of 2020 was scary, very scary. Think back with me to January of that year. The first COVID-19 case was recorded just as Australians were recovering from a summer of catastrophic bushfires. Governments found themselves making decisions in a swirling fog of uncertainty. We knew little about the virus, we didn't know how it spread, we didn't know what effect it would have. The long-term consequences of contracting the virus were a mystery. We were told that a vaccine could be years away or might not be possible at all. I remember I'd just taken up the chair of the New South Wales Education Standards Authority. What I wondered, were we going to do? What were the implications of the pandemic on my responsibilities to deliver the HSC? So I experienced, in a sense, at first hand, that challenge of making difficult decisions. So when I was asked by the Paul Ramsay Foundation and the Minderoo Foundation and the John and Miriam Wiley Foundation whether I'd be willing to work with three distinguished colleagues, Gillian Broadbent, Isabel Marshall and Peter Varghese, and then together to assess what we did right in the pandemic, what we improved over time and where we went wrong. I was really delighted to do so. I'd undertaken many government reviews. This, as David was said, was different. It was innovative. No government funds, no political constraints, no hidden agenda. And we did consult more than 350 people. We committed to keeping their contributions anonymous so that they could all speak frankly, and they did. Some were broadly satisfied with our national response. Many others were unhappy or frustrated about parts of it. A few were just plain angry. Our goal was not to apportion blame. The intense pressure under which many key figures worked very long hours in the crisis bore testimony to their commitment and resolve. So let me be clear, neither I nor any member of the panel can assert categorically that under the pressures of uncertainty, we would necessarily have given different advice. What we can say, on the basis of what we have learned, is that on some crucial issues, we would advise quite differently in similar circumstances now. We strongly recommend making some significant improvements to our organisational systems and to our institutional structures and to our workplace cultures at once, if we wish to avoid making similar mistakes in the future. Our view is that so far, overall, Australia has got through the pandemic relatively well. Our stringent border controls initially limited COVID case numbers and deaths compared to the rest of the world. That early success started to falter in 2021. Cases climbed, excess deaths rose. And numbers increased even further during 2022, reversing our early comparative advantage. By May this year, excess deaths were 16% higher in Australia than the OECD average. As our winter ends, Australia's COVID cases per million people are double the OECD average. We are, if you will, back in the pack. In our view, Australia's leaders got many of the big calls right. The speed and scale of economic intervention was, yes, courageous. The public recognition of health expertise was welcome. But we also got some consequential things wrong. Our single most egregious failure was not to adequately recognise the fault lines of Australian society and the speed with which they would come to the surface at a time of crisis. Fault lines, we suggest, in our governments and their public services, in international collaboration, in our economic systems of procurement and distribution and labour supply, and fault lines, of course, in how our federal system of government struggled to take decisions in the national interest. But the deepest fault line was societal, and our inability to address that fissure represents our greatest failure. We can argue about how well we planned or designed or delivered or communicated government programs to address vulnerabilities. But however good our intentions, the evidence is clear. We were not successful. COVID highlighted deep pre-existing disparities. People living in areas of socio-economic disadvantage were 3 times more likely to die from COVID than their wealthier counterparts. Women bore the brunt of child-minding responsibilities as schools closed, taking up an extra 4 hours of unpaid domestic work per day. Women, were more likely to lose pay and burn through leave and fall behind on savings and superannuation. Migrants whose first language was not English were disadvantaged. Overrepresented in low-paid and casual employment, the group were particularly vulnerable. The COVID death rate for people in Australia born overseas has been almost 3 times as high as those born in Australia. For some groups, it's much worse. For Australians born in the Middle East, the death rate has been 12 times as high. Intergenerational inequalities worsened. Young people lost education, jobs, networks, and precious life experience. Children will likely feel the adverse impact of COVID well into the future. Older Australians were more likely to be gravely affected if they contracted COVID, not least because of comorbidities they'd acquired over their lives. Those living in aged care were particularly at risk. More than 75% of all COVID-related deaths in 2020 occurred among residents in aged care facilities. Overall, by the middle of this year, more than a quarter of Australia's COVID-related deaths have occurred in residential aged care facilities. People with disabilities confronted a triple jeopardy during the pandemic. The consequences of contracting the virus were greater. They had reduced access to the routine healthcare they required, and lockdowns had a particularly detrimental impact on their contact with support workers and family and friends. And yet, extraordinarily, the vaccination rate for people with disability in 2021 was actually 5 percentage points lower than for the rest of the population. Aboriginal and Torres Strait Islander people were particularly vulnerable. Compared to non-Indigenous people, they already experienced disproportionate rates of poor health, mental illness and suicide. Housing conditions were much worse. It's scarcely surprising that the rate of severe illness was 40% higher for First Nations people than other Australians during the Omicron wave. And the impact of technology inequality hit hard. Around 20% of students in low SES areas in Australia reported that they didn't have a laptop or computer at home. 20%, compared to just 0.4% in high SES areas. Partly as a consequence, learning losses from lockdowns were up to 60% higher for disadvantaged students from less educated homes. So as we examine the consequences of these deep fault lines, we came to the conclusion that there were 4 key areas in which we should have done better, in which we can learn for the future. First, economic supports should have been provided fairly and equitably. Temporary migrants should have been eligible for financial assistance. A decision was made early in the pandemic to exclude temporary migrants and international students from access to the JobKeeper or JobSeeker packages. That's in marked contrast to what happened in the UK or New Zealand or Canada or Ireland, where support programs were expended to temporary migrants at work. When COVID reached our shores, around 2.4 million temporary migrants were in Australia. Over time, about 500,000 took the government's explicit advice to go home, but most could not. Few of the workers who remained had sick leave. Most had limited access to financial support or to Medicare. They felt abandoned. In July 2020, 70% had either lost their job or most of their work hours. Without sufficient paid work, they largely depended on meagre savings, handouts, and friends. More than half of international students experienced financial difficulty. Denied support, they relied on food parcels and rental assistance from the universities where they studied. Just think on this. In 2019, we proudly boasted that international education now earned almost $38 billion in export income for Australia. By 2020, overseas students found themselves portrayed as a financial burden on our nation, unworthy of government support. And that was not the only mistake. Short-term casuals should have been eligible for JobKeeper. Sick leave should have been provided to workers that didn't have it. Too often, they were forced to keep working when ill, and guess what? They spread the disease. More fundamentally, JobKeeper should have had a built-in clawback for businesses that didn't end up seeing their turnover falls significantly over the longer term. More than 20,000 businesses that received JobKeeper actually tripled their profits during the pandemic and still receive $370 million in payment. JobKeeper expenditure could have been better spent supporting excluded groups of workers. In retrospect, not including a legislative clawback mechanism was a significant design fault. Second thing that went wrong, lockdowns and border closures should have been used less. When COVID struck, governments did act decisively to unleash hundreds of billions of dollars of financial support. These economic resorts were undoubtedly beneficial, but we need to be honest. They were primarily designed to compensate for a brutal new policy in Australia. Lockdowns and border closures were not something that most modern Australians had ever contemplated, but governments imposed lockdowns and curfews on an almost regular basis over the course of the pandemic. And it is a great testimony to the public that the level of trust that still exists in this country, that most Australians accepted those restrictions, if increasingly grudgingly. Now, let me be really clear on behalf of the panel. Lockdowns, border closures were a sensible course of action in the early stages of the pandemic. There was a large degree of uncertainty. They bought us time that could be used productively to learn about the virus and to ensure that our hospitals were not overwhelmed. They gave us the time and the opportunity to develop contact tracing systems and vaccine distribution networks. Supplies of personal protective equipment for frontline workers could be secured. But too often, the extended use of lockdowns and border closures was actually driven by policy failures. We did not use the time well to establish quarantine arrangements, or COVID testing, or contract tracing, or the procurement and distribution of health supplies. Consequently, we became too reliant on lockdowns. The decision to impose them was often decided on narrow health advice. And we also became too dependent on border closures. The Australian government decided early in the pandemic to close Australia's international borders, and state and territory governments subsequently closed domestic borders at different times and to varying degrees. These controls, we have to say, were imposed ruthlessly. There was little transparency in how the rare exemptions were granted or how priorities were set. There was, quite frankly, little flexibility or compassion. Australian citizens and residents should have a moral and human right to enter their own country and move about it. Restrictions on movement should be proportionate to the risk. Lockdowns and border closures were a vital stopgap measure. Too often, they became a stay-with measure. Third, schools. Schools should have stayed open. Schools are an integral part of a child's life. For these reasons, pre-pandemic plans actually recommended that schools remain open. The Australian government's health advice, clearly conveyed at the start of the pandemic, was that attending school was safe if proper precautions were taken. But state governments took a different view. School closures were commonplace, in spite of increasing evidence that children are at relatively low risk of severe infection, and that schools do not have very high transmission rates. The consequences are now all too apparent. Closures had a significant adverse impact, not just on children's educational progression, but on their social development and on their mental and physical health. Some 60% of parents now believe that senior secondary school children have been negatively affected by the school closures. And those impacts are exacerbated for underprivileged students. The learning loss is up to 60% larger. And the closures, as Treasuries had predicted, had a significant economic cost on workforce participation and labour supply. Schools should, as now, stay open in future health crises unless there is strong health advice on pandemic infection that outweighs the multifarious costs of school closures. Protective measures should be set in place at the school level. Closures, if necessary, should be targeted. And vulnerable children should always, but always, be guaranteed access to a school. Fourth lesson, older Australians should have been better protected. Remember back, going into pandemic, aged care homes were already underfunded. The essential frontline workers were low paid, they were overworked. There was too little understanding by public health authorities that aged care communities are intended to provide a caring home for frail people to spend their final years. They were not built as hospitals. Particularly at the beginning, health authorities often restricted the ability of residents of aged care homes to go to hospital when they became infected. Yet, those homes are not designed to have the infection control standards of hospitals. If ill residents had been swiftly transferred from care communities to hospitals, the spread of infection and associated deaths would have been far lower. Equal access to the hospital system is the fundamental right of all Australians, no matter their age and whether they live independently or in residential care. Admission to hospital shouldn't depend on negotiation. There should be no implicit assumption that the worth of a person's life decreases with age or frailty. So how can we avoid these mistakes in the future? We believe in our report there are 5 key lessons. Number 1, plan, prepare, practice. Too much of Australia's pandemic response was developed on the run. Most of Australia's pandemic plans were not adequately scenario tested. The plans were hurriedly discarded in the face of the actual pandemic. Second, avoid the perils of overreach. Government regulations and enforcement too often went beyond what was required to control the spread of the virus. The implementation of lockdowns and border closures, which lasted too long, often seemed to lack fairness or compassion. Third, be consistent, clear and consistent. There was insufficient transparency in how decisions were made, who was making the decision, and the evidence upon which they were relying. Partly as a consequence, public trust in government decisions diminished over time. Fourth lesson, better balance competing trade-offs. The importance of making trade-offs was too often ignored in our pandemic response. It's vital that in the next crisis, governments carefully assessed cost-benefit trade-offs, trade-offs between saving lives and protecting livelihoods, trade-offs between physical and mental health, trade-offs between short-term benefits and longer-term adverse consequences. Fifth, most important, have societal fault lines front of mind. Policies were too often designed and implemented without proper regard for the inequalities that already existed in our society and the challenges facing particular communities. Our failure to account for societal fault lines undermined the effectiveness and the fairness of our response. We need to place vulnerable Australians at the centre of our next crisis. Social inequalities need to be considered from the start. This is the conviction that underpins our 6 recommendations embracing 14 practical proposals. Recommendation 1 is to strengthen crisis preparation, planning and testing. Pandemic plans should be prepared. Far more importantly, they should be regularly tested. They need to be flexible enough to respond to changing circumstances. Recommendation 2, establish an expert body on health. The public has greater trust in health experts than politicians. We should establish an Australian Centre for Disease Control and Prevention. Crucially, it should be independent, it should be apolitical, it should have unfettered access to the health data sets of all governments. Recommendation 3, improve government decision-making through accessing a broader range of advice and being far more transparent about the evidence used to make decisions. Advice presented to governments at a time of crisis should incorporate not just health, but economic and social and cultural considerations. There needs to be much greater emphasis on community engagement with business, with unions, with frontline civil society organisations. The public need to be told the basis on which governments are taking or changing their decisions. Here's the truth: evidence-based policy only really exists when people can see and interrogate the evidence. Recommendation 4, enhance public service collaboration, capability and communication. Governments should explicitly authorise and direct their public services to work across jurisdictions. Together, their administrations need to significantly enhance digital and data analysis, skills, raise the standard of major project delivery, and improve risk management. And here, brilliantly, coming to my conclusion, I've lost my final page. No, I haven't. Saved in the nick of time. Recommendation 6, modernise how government. Recommendation 5, modernise how governments use data. The Australian government should amend legislation to make data sharing the default option. Government should encourage the sharing and linking of de-identified data between jurisdictions by giving teeth to the Intergovernmental Agreement on Data Sharing. We should fast-track the development of interoperability frameworks for anonymised health data. Shared real-time data will significantly enhance the ability of governments to respond to changing circumstances. And recommendation 6, build a culture of real-time evaluation and learning in the public sector. We think the Australian government should establish an Office of the Evaluator General that is truly independent, truly empowered, and has a remit that includes real-time tracking of policy performance during a crisis. It should complement the more limited role of the Auditor General and, like the Auditor, report directly to Parliament. So let me conclude. Government responses to any crisis are never going to be perfect. There are always lessons to be learned, but only if we seek to learn them. The wisdom of hindsight only comes if we have the wisdom to seek it. If we fail to learn, if we fail to plan, then we're simply planning to fail. We need to be better prepared for the next pandemic. The question is not if it comes, but when it comes. We really do need to be ready. Thank you.